my colleagues, Dr. Abdul Wahid Barnawi, Dr. Umar Al-Yamani. I'm really pleased. My name is Hana Al-Subayl. I'm really pleased to be part of this session, which was long-awaiting session, and we are really pleased to announce the release of the guidelines. This session is about Saudi low back pain guidelines, and we have 3 speakers who will be telling us about the journey, the 2 years journey until this moment. So I'm really pleased to introduce our first speaker, Dr. Aldera, Assistant Professor at King Saud University, and she will be talking to us about manager of rehabilitation clinic. She is a manager of rehabilitation clinic, and she will be talking to us about the guidelines leadership team and the guidelines key themes and messages. Dr. May, the floor is yours.
Thank you, Dr. Hana. Assalamu alaikum wa rahmatullah. Good evening, good morning, everyone. It's my pleasure to present today and to present the first sessions of the 7th Saudi Spine Society conference meetings. And this session is chosen to be the first sessions because the topics is really important. It's relevant to everyone here in this clinic, in this room, and it's relevant to all the disciplines here. Today, together with Dr. Clara and Dr. Ahmed, we will present the work of the members of these societies and show the collaborations work between the national and international figures in the field. So I'll present, started with, I'll talk about the context of these guidelines. So worldwide, the prevalence of low back pain is, sorry, I need to be here. The prevalence of low back pain is really high. It's the leading cause of disability around the world. Saudi Arabia is a part of the world, and that's the burden of this problem is really affecting its individuals and affecting also the economy and healthcare system. This is a local epidemiology studies showing the impact of these problems in our societies. So before pandemic, the studies shows that the prevalence of low back pain, it was 38.8%, and after the COVID pandemic, is escalated to be 43.8%, which is really impacting in our societies. Another study shows the comorbidities of problems on the other side that is affecting women also, and show the correlations between the stress urinary incontinence, low back pain, and the core muscles endurance. And also it shows that 60% of these women with low back pain problem having the impact of this problem affecting more than the other women without low back pain. This is a 3 systematic review studies being published in 2020, and it is about the prevalence of low back pain among the healthcare workers in Saudi Arabia. And the number, unfortunately, it's really scary because in the first studies that show the lifetime prevalence among the healthcare worker, it's reached to 79%. And that was highest among the nurses and the dentists. While the second studies also was the same, the range is between 40% on the weaker prevalence and reached to up to 81% on the career life prevalence. The last study is also the same. It's found it's reached from 64 up to 89% the prevalence of low back pain among the healthcare worker, and this numbers is, it is high and it's alarming as well. For this reason, the health holding company oversees a complex program to transform the healthcare system in Saudi Arabia to be aligned with the vision of 2030. One key element here is to establish a national guideline program that ensures evidence-based clinical care at all the levels. To achieve this, the health holder company partnered with Elsevier, which is a leading distributing evidence-based knowledge and experience with this implementing the international guidelines. In collaboration also with the key stakeholders, the national one, the Saudi Health Council, National Centers and the National Centers for the Evidence-Based Medicine. They started with all the guidelines by publishing these new studies about the new era and the national guidelines development in Saudi Arabia, and they present their work and what they will, the plan of the work. So we do have here 4 key elements. The first one is to the evidence base by using the global best practice in guidelines development like GRADE and etc. And also the efficiency of this product by building on existing efforts whenever it's possible by doubling these guidelines. Also to make it local relevant by engaging a national team, ensuring that the guidelines is feasible in Saudi Arabia. And lastly is to access and impact by focusing on disseminations, the Saudi Health Care website and order sets implementations. To achieve this work, they recruited 12 local expertise as a task force members. We had around 10 workshops, that's 2 hours or sometimes more, for holding these scoping and recommendations. They make a priority for 11 clinical questions. We did a 61 systematic literature search, conducting for clinical questions and contextual factors. More than 25,000 title and abstracts double screened, 157 full text double screened, 62 studies meta-analysis, 104 force plot created, and then we ended up by 11 graded recommendation. This is the task force lead, Dr. Ahmed Turkestani, myself, Dr. May, and Dr. Hanan Reyes. We started this like 2 years ago when they nominate our name to be a lead for this task force. And then I think it started from November 2021. And then from this time, we recruit the national task force members where they're working so hard with us. Prof. Sami Bahlas, Dr. Hani Suleimani, Dr. Umar Yamani, Prof. Walid Awad, Dr. Yahya Al-Qahtani, Dr. Khalid Al-Ghamdi, Khalid Al-Ghamdi, Dr. Hanan Al-Subayr, Dr. Muhammad Badawi, and Dr. Ibrahim Al-Maghlouth, sorry. So they are our local national task force. They spend hours and hours to meetings together, and I'm really proud to have this multidisciplinary teams that really puts all this knowledge and efforts together. And we do have the local and international peer reviewers. After we finish developing this program, these guidelines, we give it to our local and international peer reviewers. And I would like to thank Dr. Naif bin Dajan because he was keen to review our guidelines in the last minutes. Also, there's a behind-the-scene Minister of Health holding company and Saudi Health Council sponsorships. This is the leads who was facilitating things and connecting us with Elsevier. This is the task force members also. Again, it's behind the scene, where is the Elsevier guideline support team. They're working very hard during this 2 years to develop this program, or this is guidelines. We reached to the method where I will ask Dr. Clara to present it. Thank you very much.
Good morning, everyone. So for the fun part, we have our Dr. Clara Braunhuber, and she was the guideline project lead